Welcome to the deep dive. Today we're exploring a pretty fascinating story that hit the news just a few weeks back. It involves a significant misstep, really, from the White House and the Department of Health, more than just a simple error.
Exactly. Our goal today is to get past those initial headlines. We'll be drawing on Professor Lin's analysis from his blog, professor.lin.com. We want to understand what actually happened, why it matters, and what it teaches us about critical thinking, especially now with so much information out there. It's really about debunking a very public claim and just raising awareness about checking the sources we rely on.
Okay, let's break this down then. The core of it is this Make America Healthy Again report, the MAAHA report focusing on children's health. It was presented with quite a bit of fanfare, actually. President Trump, Secretary Kennedy, May 22nd, 2025. They called it a landmark study, the first clear assessment from the federal government on kids' health. Said it was based on rigorous work by talented and most respected people.
Yeah, and what's really striking is how fast that narrative just crumbled. Just a week later, May 29th, major outlets, the New York Times, CNN, USA Today, and especially Notice, the investigative sites, started flagging huge problems. Notice was actually first to report the MAHA report was, and I'm quoting here, filled with errors, from defunct links to erroneous conclusions, and 7 of its cited sources simply didn't exist.
Didn't exist. Wow.
Exactly. 7 of them. It really makes you question the whole process, right? How does that happen at this level?
Definitely. And this is where looking at the specifics gets really, really interesting. These ghost papers, these misrepresentations. It shows how these errors can creep in. So take Mariana Figueroa's research. That's one example. The MMHA report cited her work, supposedly from the Journal Pediatrics, claiming it showed electronic devices in kids' rooms disrupt sleep.
Right. Standard concern.
But Figueroa herself came forward and said, hold on, my research was actually on college students, and it measured melatonin inhibition. That's about the hormone that regulates sleep cycles, not overall sleep time. Big difference. And crucially, it was never published in pediatrics.
So completely misrepresented, different population, different metric, wrong journal.
Exactly.
And it didn't stop there. Another case, Catherine Keyes, an epidemiologist at Columbia University. She studies disease patterns. The report listed her as the first author on a paper about adolescent anxiety during COVID-19.
Okay.
But Keyes told Notice directly, I did not author that specific paper. She seemed genuinely surprised and stressed that citation norms, the basic rules of crediting work, are vital for, quote, conducting and reporting rigorous scientific research.
So not just a typo, a fundamental error in attribution.
Precisely. It really undermines the claim of rigorous work.
Then there's Robert Findling from Virginia Commonwealth University. He was cited for a study apparently showing that drug ads lead to over-medicating teens because they blur normal behavior with symptoms.
Another plausible-sounding claim.
Plausible, maybe, but Findling stated very clearly he had not done such research. Period.
Just fabricated. Or attributed completely wrongly.
Seems like it. These aren't small mistakes, are they? They're foundational issues with the report's evidence.
And connecting this back to Professor Lin's take, his article title says a lot. White House Embarrassment, Citing Ghost Papers. He frames it pretty starkly, suggesting this is potentially science being manipulated by politics. He even voiced concern that the health department might risk becoming like a pseudoscience propaganda department. Strong words.
Very strong. And the comments on his blog post add another layer. One person pointed out how similar this science washing in the report feels to, marketing for health products that throw around terms like scientific evidence without real backing.
That resonance is interesting.
But another comment brought up something, frankly, a bit chilling. The idea that maybe advanced AI tools could be generating these citations, making them look credible but being completely fake.
It's a disturbing thought, isn't it? Adds a whole new dimension to spotting misinformation if AI can create seemingly legitimate but ultimately hollow references.
It really does. So, okay, what's the big takeaway here for you listening? This deep dive, it isn't just about one government report messing up, though that's significant. It's really a stark reminder, isn't it, about critical thinking, about the absolute need to check sources, especially when health claims are being made.
Yeah.
Even from official channels.
Absolutely. And it leaves us with a crucial question, really. In this age where information and, misinformation spreads like wildfire, sometimes looking incredibly polished, maybe even AI generated, what steps can you actually take? How do you ensure that what you're reading, what you're basing decisions on, is actually solid and rigorously backed up? It's a challenge that goes way beyond just health reports, It touches everything we consume online and off. Something to really mull over.